Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Staggering to think about the impact on communities when those of us who have been through trauma, we know how that affects us on an individual level. So if you multiply that, as you just said, by the number of people in a community, it's really staggering to think about the impact on those communities due to that trauma. I appreciate you walking us through that, Christian. I want to tell you about, you may be familiar with him, Dr. Stephen Nifty. He's a licensed psychologist and coordinator for Spalding University's Collective Care Center in Louisville, Kentucky. According to him, increased rates of suicide among black men rather, a life expectancy gap, and post-traumatic stress disorder are all signs of cities across the country that they're realizing, or should realize rather, that racial trauma is a public health issue. We don't call it that often, but it should be called a public health issue. This is a quote from him. We've essentially handed down 10 or 15 generations worth of boxes of trauma that have yet to be unpacked. And that's what's contributing to a lot of those biological and mental health related issues that we're having, unquote. I thought that was a powerful quote. 10 to 15 generations of boxes that have yet to be unpacked. What are your thoughts about that, Kristen? And very specifically, how do we get at a problem that's been pervasive for so very long? Our mothers and fathers and grandparents and great grandparents and great great grandparents have all been impacted by this. So how do we today get at that when it's been around for so long?
Well, I think the first thing we do, you mentioned it earlier, what you were just saying is that racial trauma is a public health issue and it should be notified. Noticed is that and notified throughout states and county governments. And right now, actually, the governor of California and actually California Department of Public Health did proclaim race and all these other issues as a public health issue and an emergency in a sense. So that's the first step is really getting that legislation and those policies behind this work that's going on with health equity and and basically really getting those the funding behind the programs. And the second, we have to start doing we started talking about community, right? So we have to really start doing, I call it king talk, right? It's called king talk, and a lot of them in the mentorships that I do with youth, there's a king talk segment that I do. And that means at an early age, I call it king talk because our young men should see themselves as kings, And so basically, what I do a reference. I have these pictures, and I have actually the visual, like costumes, things of that sort, where kings uniforms, and basically where we explain how kings in Africa and Europe and pharaohs in Egypt and South America, the Aztecs, actually, these kings and leaders of their villages and community would talk to them positive words of affirmations, and they spoke life into their culture, into their future, and affirmed all these great things they would do, for their people once they became kings at 8, 9, 10 years old. They were constantly talking to them at an early age. So even before they recognized it. So this manifestation from the community as elders is really key in the building of the youth. That's where it really starts at in the community. And I think right now what may be an issue today is that the community is bleeding and so injured from systemic barriers that we discussed, right? And that's difficult to be present for our youth when we're going through our own issues, right? We're trying to keep on the lights and pay the bills and buy food and things like that. And we have the institution of church. Now, church and spirituality and religion in the Black community was one of the main cornerstones. And statistics show that that's the institution of church is not as important, or people aren't going like they used to anymore. So, and back in the day, that's where all the resources were: your teachers and your doctors and your counselors, things of that sort. So, as I'm referring back to a theme of community, as you can see, and supporting that community aspect.
It's important that we function as a community, and we certainly here at Brother Be Well are trying to foster that community development and support here. BrotherBeWell.com is that website. I love talking to you, Kristen. You always remind me to do some plugs for some of our other productions. You mentioned that ACES session that we did. We've got a variety of videos just like this. So if you're enjoying this one, take a look at the others at BrotherBeWell.com. Let's continue on with this conversation. It's hard to talk about community trauma and people of color today and not talk about interactions with police. There's a history in this country that can't be ignored. We're not going to ignore it here at Brother Be Well, but all individuals and communities involved in those interactions have been traumatized. We need to recognize that. Many who patrol our communities also show signs of stress and trauma, according to a recent University of Buffalo 5-year study showing that police officers suffer from symptoms of PTSD at rates higher than all other demographic and professional groups. I thought that was interesting. A lot of our work here at Brother Be Well is with the medical community, and I would have thought maybe doctors and nurses were highest, but police officers are suffering most, according to this study from PTSD. I'm wondering, Kristen, you as a marriage and family therapist, have you treated consumers, especially community members or members of law enforcement rather, who are dealing with mental health issues related to police interactions? And if so, talk about that a little bit. But I'm curious about your thoughts about community trauma as it relates to interactions with members of law enforcement.
Sure, yeah, and this is a very difficult subject regarding treating law enforcement officers. In my, in my work, in my experience, working with law enforcement officers or anyone who's, in the law enforcement community and the family, usually when it comes to race, I can relate. I've lived experience, someone who's as a in that disparate group of a minority. But it's really hard to really empathize and put yourself in the shoes of that law enforcement officer when you're not a policeman. So I can only go so far as a therapist, but then again, I use their life experiences and I use their story to really, funnel, the session. So it's very true. So as communities experience race trauma from law enforcement and officers experience with trauma, and PTSD looks a bit different from those who are oppressed. But, really police officers report much higher rates of depression actually and burnout, PTSD and anxiety than the general population, and almost 25%. A recent study, done 25% of police officers have experienced these suicidal ideations at least one time in their lifetime. So that's a quarter of the staff, of officers who basically experience the suicidal ideation. Again, there's a difference between ideation and suicide thoughts. There's a thoughts and there's ideation. More cops die by suicide than in the line of duty. So that's staggering. Their main line of the in terms of death, it's suicide. It's not being killed in the line of duty. And lastly, most officers do not seek care for mental health services. So you have these issues that are compounding, and they're out here, serving the community. And in reality, they need the support as well. And so, from my experience working with law enforcement officers, really, their main issue stems from isolation and shame, and that the belief that mental health professionals can't relate to those working in law enforcement jobs. So, what can I tell you about your job, basically? How can I empathize with you, so how they're thinking? So, there's also a lot of rapport building that has to happen, right? A lot of breaking down walls and trust building that has to occur. It may take months before I can really get into the therapeutic work with some of these officers. And they're also concerned about confidentiality. All those sessions are confidential, for the most part, unless they're thoughts of harming themselves or others. There's that confidentiality piece that they struggle with. So most are really ashamed to share their symptoms once they do get into therapy, once they do get past that wall, because they feel those who seek mental health services are unfit to serve as officers. And these are all the issues that come up after you really build that rapport and that trust with them.
Two things came to mind as you were talking, Kristen. First, you were talking about suicidal ideation, members of law enforcement dying by suicide at higher rates. I thought about all the officers in the fairly recent uprising in Washington, D.C., and I was very surprised to learn one by one that the number of police officers who were trying to protect our nation's capital had died by suicide. So that struck me and it resonated with me as you were telling that story. The other piece, though, that I don't want to get away from is as we think about stress and anxiety among law enforcement, and you mentioned it's hard for us to empathize if we've never been in those shoes, right? And it's sometimes hard for you to empathize with anybody if you're not walking in those shoes. But as we've been talking about these two issues, law enforcement and people of color, I just shuddered when I thought about the people of color who are members of law enforcement. I mean, they're facing the community racial trauma that we're talking about and all that trauma that's coming at them by way of them being members of law enforcement. It's just really, um, yeah, I shuddered when I thought about it. So we gotta address their concerns and help them as well as much as we can. Would you agree?
Absolutely, and that scenario that you explained is where we get into something called intersectionality. So intersectionality is when you have multiple not biases. You have multiple barriers that you may experience. You may be a LGBTQ woman who's African American, who's a single mother. So now there's intersectionality now going on. There's several layers to in terms of that person. They're multifaceted, and we have to learn ways to address those issues.
I want to ask you this question because this occurred to me as we were putting this conversation together. Um, can shared trauma and pain bring people together? And that connection might not seem obvious to you, but I thought about the old adages that I grew up with, the ones like misery loves company and what doesn't kill us makes us stronger. And so I wondered if communities like the ones we're talking about, people of color communities, for instance, can find strength in knowing that we're all in this together. Is it effective to lean on each other as we weather the many storms that come our way?
Absolutely. That's where it started, right? In the beginning of the development of society and mankind, it started within community, and some cultures now still continue on this path. You take care of your neighbor and things of that sort, and you fund and you heal within the community. You have healing groups within the community. So group therapy, the theory and the whole idea of group therapy is healing via community. Members of 12 in your group therapy group. Whether that's an AA group or some type of harm reduction program through substance abuse treatment. So obviously these theories work because they're being used in different capacities and different levels. So I would really say to start internally inside the village and family to learn about your own epigenetics. The epigenetic genetics of seeing what has been passed down multi-generationally. And this is actually, you're doing some of the pre-work for whenever you go to therapy, right? So when you go to therapy, you can provide this with to your therapist and share, hey, this is the work I've done on my own. I've done a genogram. I've broken down the history trait of alcoholism and shown that my 3 generations of alcoholism that occurred in my family, or things of that sort. So really doing that internal work first, and then really looking for yourself. Think, what are you seeking in yourself, as resilience versus trauma. Here goes going back to culture now. In the African American community, sometimes we see resilience, right, as something good and strong, but in reality, that resilience that we're doing is suppressing a true symptom. So we're acting strong, we're being strong, but there's actually something that needs to be addressed there. So self-reflection, what is this trauma or just resilience? And then those safe spaces and those healing groups are very important too in the community to utilize those.
You've walked us right up to my favorite question when we're talking about trauma related issues and conditions, Kristen. We're on a path to healing here. Let's just continue it as we get ready to wrap up. What are the other ways in which we can start healing from collective or community trauma?
I think another one is really we have to identify, we have to start fielding our trauma as well. We really have to, as a community, really have to do a better job, myself included, as being the fielder and the screener. So if we see things online or see things that are troubling, we know it's triggering for us. We know it can be difficult for us. We have to really work on avoiding that, not clicking on that link. If we know it's something's going to be traumatic, if it's another incident that we didn't like before, we have to start really feeling our feels and knowing what triggers us. And I know that's going to be something else we talk about, but really understanding how our body operates and what our endpoint is and how much we can take. That's one thing I would like to leave in addition to the other points that I answered on the previous one.
Really appreciate it, Kristen, and appreciate the plug for the trauma triggers conversation too. Go to brotherbewell.com. We have a whole conversation for you about trauma triggers that you want to check out. I want to thank you, Kristen Jacobs, before I let you get away from us, marriage and family therapist and Brother Be Well clinical advisor. As always, really appreciate your expertise and care that you've shown for this conversation. Thank you, sir.
Thanks for having me. I really appreciate the time.
Really, we'll see you next time. Looking forward to it. And looking forward to you coming back to us here at Brother Be Well for another of these trauma and healing conversations that we're having that are made possible thanks to the support from Blue Shield of California's Blue Sky Initiative. That initiative boosts access to mental health support. You can learn all about that fantastic initiative at bluesky.blueshieldca.com. That's bluesky.blueshieldca.com. For more information about any one of a number of mental health topics, more in this trauma and healing series, but all kinds of topics, you can find videos just like this one, audio podcasts, compelling print pieces, all designed to help support boys and men of color, 13 and up, African American, Latinx, Asian and Pacific Islander, and Native or Indigenous. It's all at brotherbewell.com. So check all of that out. We're a membership supported service, so we ask you if you can to join as a member. If you'd like to kind of just stick your toe in a little bit and check us out first, you can give us your email address and sign up for our blog, and you'll start to get 2 or 3 times a week updates on blog pieces that go live. So please check us out and support us if and how you can. My name again, Michael P. Coleman, Content Director for Brother Be Well. Until next time, and I'm already looking forward to that next time, I want to thank you for your time and encourage you to do 2 things. Take great care of yourself, and then when you get that down, reach out and help take care of somebody else if you would. Till next time, bye-bye.